Hi, welcome to Almost But Not Quite, an educational video for the healthcare provider in their care for the late preterm infant. Hopefully, following this educational clip, you'll have more information to guide your practice when caring for these infants. Almost But Not Quite, an educational video. All infants are created equal. True or false? The late preterm infant, as defined by ACOG, is any infant born between the gestation of 34 and 0 and 36 and 6/7 weeks based on a 40-week gestation. Why should we be concerned with the stabilization of the late preterm infant? Because delayed or inadequate transition can lead to serious conditions in the late pretermer. These can include risk for poor feedings, temp instability, low blood glucose, respiratory compromise, and elevated bilirubin levels. These infants require frequent assessment and close monitoring to prevent complications associated with earlier than term delivery. What can we do to give our late preterm infants a good start? Monitor, assess, promote. Monitor vital signs. Recommended by A1 every 30 minutes times 4, followed by every 4 hours for the first 24 hours of life. Now, your institution may not follow them as frequently. You're always covered by policy, but always follow your instinct. If you think your baby needs more frequent vitals, by all means you should be doing that. Blood sugars are another concern. Serum glucose reaches an all-time low 1 to 2 hours after birth, so we do need to be watching those closely. This is currently covered by most institutional policies. Assess. Assess the temperature. You cannot have a baby who gets cold do well. They need to be watched to help with their feedings and any other stress factors. Promote. Promote skin to skin. It's the most important thing you can do for these little guys. It decreases infant stress, optimizes respiration and oxygen saturation, helps with temperature stability, and most importantly, promotes bonding. This applies to all babies, all pretermers, whether breast or bottle feeding. Delayed bathing. These little guys are going nowhere. They do not need to be bathed within the first to second hour of life. Give them a chance to get temp stable before we do that. And parent education. Educate your parents that their baby is not quite term yet. I hope you found the information on the care of the late preterm infant useful, and you'll be able to put it to practice in your everyday clinical settings. Please remember that these are almost but not quite babies who need your special assessment skills. So what do we know? Show me what you know from this video. We know that 34 and 0/7 to 36 and 6/7 is what? Yes, the late preterm infant. Delayed bathing. What do we want to do with delayed bathing? Why? We want to promote temp stability with our little late pretermers. We're going to delay those baths, and we're going to educate our parents as to why. Skin to skin, the golden gift for the late pretermers. We're educating on skin to skin. We're promoting skin to skin. We're monitoring that skin to skin is occurring because it is decreasing infant stress. It is promoting bonding. It is all of the answers. Hypoglycemia. We're going to be on the watch for that with our little babies who may be feeding poor. They're learning how to breastfeeding. They may tire easy. We're paying close attention to that. Respiratory distress, temp instability, hypoglycemia. These are 3 red flags, things that we want to watch for. They're possible signs and symptoms of infection, things that we want to be reporting and passing on and making sure that people are aware. So the next time you have a late preterm infant in your couplet assignment, I hope you'll remember almost but not quite. Monitor, assess, promote. Keep a close watch on these infants who are almost term but not quite. A1, Association of Women's Health, Obstetric and Neonatal Nurses, was the source of reference for this educational content. They have created guidelines for evidence-based care of the late preterm infant. Please visit this site as well as ACOG, American Congress of Obstetricians and Gynecology, for more information.